So is Obamacare dead on arrival? Republican Governors Scott Walker and Bobby Jindal penned this joint op-ed today in the Wall Street Journal, arguing that Obamacare is fundamentally unworkable and will leave the American people paying a heavy and unnecessary price. So we are honored to be joined exclusively tonight by Louisiana Republican Governor Bobby Jindal. Governor Jindal, as always, it is great to see you. You know, besides the fact that all the businesses are going to dump their wage workers into these pools that haven't even been created yet, these insurance pools. And besides the fact that there's no verification, what else is new? I mean, I don't see any part of this that's going to work.
No, you're exactly right. It's great to be back on the show with you. Thank you for having me. Look, this was a bad idea. Now you've got bad execution. All along, they keep missing their own self-imposed deadlines. They told the small businesses we're not going to have multiple options in the exchanges. They said they're not going to be able to verify the income for those getting subsidies. Then they said they're not going to be able to enforce the employer mandate. Every time they get to a deadline, they miss it. You look at all the promises the president made. Remember, he said if you like your insurance, you like your doctor, you can keep it. Turns out even the government's estimates are that over 7 million Americans may lose their employer-provided coverage. 10% of employers may drop their coverage, according to private estimates. The president said he was going to cut premiums $2,500. Premiums are going up, not down. The actuaries say individual market premiums could go up on average 30%. You're seeing in market after market plans withdrawing. In my home state of Louisiana, Blue Cross Blue Shield, which has already got 25% of the market, they've said they'll participate, but they've said premiums could go up substantially for people. So I think there are going to be a lot of very disappointed, a lot of very frustrated people. This is a bad law. The execution has been awful. It needs to be repealed.
Labor unions. Labor unions are really annoyed. They're losing their Cadillac health care packages, which goes all the way back to subsidies in the late 1940s, the so-called Taft-Hartley subsidy. Their workers, Governor, may wind up in the insurance exchanges, if they ever get them together, in a much smaller, much less, generous insurance package.
That's exactly. You got three of the largest labor unions now writing the administration saying this could destroy the 40-hour work week, the backbone of the middle class. Three labor unions that, by the way, supported this president, helped him get elected, helped support the folks that passed this awful law in the first place. It is time. Look, they repealed the mandate for employers, not individuals. That makes no sense. They need to repeal the entire law. The reality is we don't need a one-size-fits-all solution from Washington, D.C. There are problems in the health care marketplace, but you said it before. You said it right. There are ways to fix that without running towards a government-run health care system.
Well, I don't
let's
see.
Be very clear.
I don't see, Governor, seriously, I don't see how you can keep the individual mandate going without a verification system, unless I'm completely cynical. Let me ask you, maybe Team Obama wants that. They want the entire world to sign up for it so they can have the control and the fees, and they really don't ever care about verification. Am I being too cynical there?
No. Well, look, this administration has proven they're very happy having more people dependent on the government. They're very happy having a government-run health care. I think the left has always wanted a government-run single-payer system. They'll call it competition, but the government will dictate what benefits they can offer, what pricing they can offer, what profit they can make, what they can pay, how they can market. The reality is this is government-run health care. I think you're exactly right. This is an administration very comfortable with people dependent on the government as opposed to being self-sufficient, and I think this is part of a bigger ideological. This is ideologically a bad law, but now we're finding out not only is this administration ideologically to the left, they're also incompetent. They can't even execute their own bad law. There's a reason that governors, it's the state level, we want flexibility. We know what works in Louisiana may be different than what works in Wisconsin. We don't need D.C. telling us what doctors we can see, what health care plans we can enroll in, how we can get our health care. I think a lot of people are going to be upset when those premiums go up that significantly. Listen, if the president had done what he had promised, he said he was going to bend health care costs down, didn't do it. He said he was going to provide choice and competition. That's not happening in a lot of marketplaces. He said if you like your doctor, your health plan, you can keep it. That's not happening either. He entitled it the Affordable Care Act. It's not doing anything to make health care more affordable. It's not doing enough. If he was serious, he would have cracked down on some of the frivolous lawsuits. If he was serious, he would have allowed us to buy insurance across state lines. If he was serious, he would have expanded, not restricted, health savings accounts and other competitive market devices.
Give the tax break to the families and the individuals, for heaven's sake. Governor, before I lose you,